World AIDS Day 2024. World AIDS Day, observed annually on December 1 since 1988, serves as a global platform to unite people in raising awareness about HIV, which is human immunodeficiency virus, or AIDS, acute immune deficiency syndrome, and demonstrating solidarity against the pandemic. It is an opportunity for governments, organizations, and communities to reflect on the progress made in prevention, treatment, and care while highlighting the ongoing challenges. This day recognized as one of the most significant international health observances not only spreads awareness but also commemorates those who have lost their lives to AIDS and celebrates milestones such as expanded access to healthcare services. By fostering understanding about HIV as a critical public health issue, World AIDS Day underscores the integral connection between combating AIDS and achieving universal health coverage and the right to health. 2024 theme: Take the Right Path. My Health, My Right. The theme for World AIDS Day 2024 is Take the Right Path, My Health, My Right, emphasizes the importance of healthcare access and the empowerment of individuals in managing their health. It underscores the need to address systemic inequalities that prevent vulnerable populations from receiving essential HIV prevention and treatment services. This year's theme highlights the role of human rights in ensuring that everyone, regardless of the background or circumstance, can exercise their right to health. By focusing on the rights-based approach, the 2024 campaign seeks to foster inclusivity, reduce stigma, and encourage global cooperation to eradicate AIDS as a public health threat. Current state of HIV or AIDS, a global and national perspective. As per the Global AIDS Update 2023 released by the United Nations Program on HIV or AIDS or UNAIDS, significant strides have been made globally in combating HIV or AIDS. New HIV infections have declined in countries like India, where a robust legal framework and increased financial investments have facilitated progress towards the goal of ending AIDS as a public health threat by the year 2030. India, in particular, has been acknowledged for strengthening laws to protect the rights of vulnerable populations. On the national front, the India HIV estimations 2023 report highlights that over 2.5 million people are living with HIV in India. Despite this, the country has made notable progress, with adult HIV prevalence recorded at 0.2% and annual new HIV infections estimated at 66,400, a 44% reduction since 2010. India has outperformed the global reduction rate of 39%, demonstrating the success of sustained interventions. The availability of free, high quality, lifelong treatment for over 16.06 lakh people living with HIV through 725 ART or antiretroviral therapy centers as on June 2023 and 12.30 lakh viral load tests conducted between 2022 to 2023 reflect India's commitment to ensuring care for affected populations. India's response to the HIV or AIDS epidemic, a comprehensive approach. India's battle against HIV or AIDS epidemic began in 1985 with zero surveillance to detect the virus in various population groups and geographic locations. The initial phase from 1985 to 1991 focused on identifying HIV cases, ensuring blood safety safety before transfusions, and generating targeted awareness. The response gained momentum with the launch of the National AIDS and STD Control Program (NACP) in 1992. This marked the beginning of a systematic and comprehensive approach to tackling HIV or AIDS in the country. Over 35 years, NACP has become one of the largest HIV or AIDS control programs in the world. Evolution of the NACP phases. The first phase of NACP from 1992 to 1999 prioritized creating awareness and ensuring blood safety. With the launch of the second phase from 1999 to 2007, direct interventions were introduced across prevention, detection, and treatment. States were also equipped with the capacity for effective program management. The third phase from 2007 to 2012 saw a major scale up of activities with decentralized program management reaching district levels. Fourth phase from 2012 to 2017 consolidated earlier efforts with increased government funding, ensuring the program's sustainability. The extended NACP Phase 4 2017 to 2021 brought several landmark initiatives, including the passage of the HIV and AIDS Prevention and Control Act 2017, which guarantees equal rights for HIV positive individuals and prohibits discrimination against them. This act which came into effect in September 2018, strengthened India's legal framework to safeguard the rights of people living with HIV. During this phase, the government also launched the test and treat policy in 2017, ensuring that every individual diagnosed with HIV receives free antiretroviral therapy, irrespective of their clinical stage. To re-engage people living with HIV who had discontinued treatment, the Mission Sambar initiative was implemented in 2017. The onset of the COVID-19 program during 2020-21 posed significant challenges to the program. However, NACP leveraged information technology to enhance program review, coordination, and capacity building efforts. Innovations like multi-month drug dispensation and community-based ART refills ensured the continuity of treatment services during the pandemic. NACP Phase 5 renewed focus on ending AIDS, launched as a central sector scheme for 2021 to 2026 with an outlay of rupees 15,471.94 crores. NACP Phase 5 aims to build on past achievements and address persistent challenges. The NACP Phase 5 aims to reduce annual new HIV infections and AIDS related mortalities by 80% by 2025 to 26 from the baseline value of 2010. Additionally, the NACP Phase 5 aims to attain dual elimination of vertical transmission, elimination of HIV or AIDS related stigma, while promoting universal access to quality STI or RTS services to at risk and vulnerable populations. NACP Phase 5 is designed to achieve specific targets by focusing on 8 guiding principles, including community centered approaches, synergy building, technology integration, gender sensitive responses, and fostering partnership. Key collaborations are planned with public and private sectors, leveraging existing government schemes for cost effective and service delivery. The key objectives of NACP Phase 5. First of all, it is HIV or AIDS prevention and control. Ensure 95% of high risk individuals access comprehensive prevention services. Achieve 95 to 95 targets. That is 95% of HIV positive individuals know their status. 95% of those diagnosed are on treatment, and 95% of those patients achieve viral suppression. Eliminate vertical transmission by ensuring 95% of pregnant women with HIV have suppressed viral loads. Less than 10% of people living with HIV and key populations experience stigma and discrimination. STA, sexually transmitted infection, or RTA, reproductive tract infection prevention and control. Provide universal access to high quality services for at risk population. Eliminate vertical transmission of syphilis. Conclusion. World AIDS Day 2024 serves as a reminder of the work that remains to be done to eliminate HIV or AIDS. Through the NACP Phase 5 and its rights-based approach, India has made significant progress in prevention, treatment and care. However, challenges like systematic inequalities and social stigma require continued focus. The theme, Take the Right Path, My Health, My Right, encapsulates the collective mission to foster inclusivity, uphold human rights and ensure equitable healthcare access. The world moves closer to achieving the goal of ending AIDS by 2030. India's efforts exemplify the power of collaborative action, innovative strategies, and an unwavering commitment to health equity. By addressing the structural challenges, and scaling up successful interventions, India is poised to lead the global fight against HIV or AIDS, ensuring a healthier, stigma free future for all.